Magic 89.9.
Today's best music match 89.9. Okay, before we get started, I just have a confession to make. I'm feeling a little replaced and jealous. I brought my boy Kobe with me.
Yeah.
And, you know, the way he's looking at Coach, it's like Jesus Christ just came down from the spiritual realm. Totally ignores mommy. Who feeds you? Who feeds you? Who bathes you?
I'm the wizard of treats.
I know. I swear, Doc Apple, whenever he sees Coach, he only cries, like the happy cry, you know, with matching Tiny Pete.
Well, I tried to call him earlier. I said, Kobe.
Diba, Deadma?
And
Went straight. No, went straight to Coach. I was telling Coach, I know my voice is really that deep, but come on.
you know what?
Yeah.
Doc Apple has been trying hard to lower her voice.
My goodness. But anyway, welcome to the show. It's Pets in the City this beautiful Monday afternoon. And another packed afternoon for us. I'm very, very excited to be talking to our guests in a few. And please do join us because ito very, diba? Very
Specialized.
Yeah.
Yes.
Yeah.
Unheard of. And I was like, when Doc Apple got him to guess, I was like, whoa, really? Tas may bionic dog tayo, guys. Oh, bionic dog talaga. But
Hey, I'm also bionic, remember?
wait, what?
I also have a plate on my left leg.
What?
Motorcycle accident a few years back. Recovered.
Living dangerously.
Yes. So I was excited because I'm with my dogs.
Oh my goodness. So
I'm with my people.
oh my gosh. Okay. So today on the show we have
Doc Aris, Hapatinga. Yeah, it's already on.
Yeah.
Yes, good afternoon to the listeners.
Welcome to the show.
Welcome to the
Thank you,
show.
thank you for having us.
And of course,
then we have fur mom, Hannah, and bionic dog.
Bionic and Kobe.
Yeah. Tofu.
Hi, good afternoon, everyone. Thanks for having us here.
You guys, if you're watching, for those of you on the radio, you can't see them, but we do have.
you can watch us at kick.com/magic899tv.
Teka lang.
Just in case you're driving, use your imagination.
Pero wait lang. Kasi ito official na to eh. Kukyo ko lang wait lang Pakiligin natin si Doc.
I know.
To the City with Tina Ryan, Dog Coach Francis, and Doc Apple.
Yeah. All
May kasamang
right.
kilig yun.
Thank you, Sarge. Thank you,
I love you,
Sarge.
Sarge.
Wala ka ng kawala, Doc.
Yeah, you are now hooked in, you know.
You're part of the fam now.
Yeah,
Even
you're
designer
anchored.
dad. Sabi ni
Okay.
designer dad, wow, kasama na name ni Doc Apple. No!
Yeah, designer dad. Kinilig ako doon.
Hi to JP and Christian.
Hello, JP and Christian.
And Coder Alpha. Who else? And
Everybody
of
on
course,
Kick.
designer dad. So please do join us. I have room for one more song before we take a quick break. And again, if you have any questions, pet health related, behavioral issues, I got two experts here. And then now
We have a specialist actually.
We have a specialist.
Veterinary orthopedic surgeon. So we
there
have
you
Doc
go.
Aris here.
There you go.
Fire away.
So here we go with something from Kygo. This one's called Hold On Me on today's best music.
Magic 89.9.
Magic 89.9.
Dog trainer and on radio, it's Dog Coach Francis. What's up, y'all?
What's up, y'all?
And we got
And
a resident
veterinary.
Yeah,
Veterinarian.
I'm Doc Apple, and so excited today because it's the first time for me to hear the new breaker with my name on it.
Okay, so today we're diving into a topic that many fur parents hope they'll never have to face.
Oh, yeah.
Including me, because my dog breed, right?
Yeah.
I mean, Doc Aris will explain what IVD ba? IVDD. Yeah. Doc, it stands for
Intervertebral disc disease.
Oh my gosh.
Sounds,
yeah, that's
sounds expensive.
very expensive.
But it's manageable.
Oh, there you go. There you go.
Oh,
That's
there
what
you
we want to
go.
hear.
That's what we want. Yes, it can be expensive, but anything for our dogs, right?
So today, what happens when our pets suffer broken bones or torn ligaments or need complex orthopedic surgery? We are being joined by one of the country's highly respected vet orthopedic surgeons, Dr. Aris B. Hapatinga. Doc, welcome to the show.
Thank you so much.
Hey.
Good afternoon.
Welcome.
Welcome to the show.
Yeah, and of course, we have fur mom Hannah and Doc Aris's patient?
Tofu.
Tofu.
Oh my gosh.
Just in
Okay.
case, tofu is.
Shiba
Anybody.
Inu.
All right. And Shiba Inus are from Japan, oldest and smallest native dog breed with genetic roots dating back to 7,000 BC.
And tofu hasn't barked.
You haven't heard?
They don't really bark, but when
That's
they
what-
do, it's high pitch.
That's what Hannah
they
said.
scream. It's called a Shiba scream.
The Shiba scream.
So when they want or need something, they end up
Screaming.
Screaming.
Yes.
Make.
my staff at the dog ranch, way before when we had a lot of Shibas, they called them sonic booms.
Sonic boom.
Sonic boom talaga.
Yeah, because he was really loud.
Yep, that makes sense. Yes.
Okay, before we get serious, actually, Doc, we'd love to know what made you choose orthopedics. Like most vets treat everything, but you specialized in bones and joints. Was there a particular case that inspired you?
Yes. Way back, I think 10 years ago, I'm into, rescue groups happen to find me for some reason.
Okay.
And I had a client then from, I think she's from the US Embassy.
Oh,
And she rescues cats.
okay.
Okay. And then they happened to come to our clinic in Santa Ana because they wanted the cat's broken bone fixed.
Okay.
So when she
Okay.
came to me, that then I don't know. I know very little. Just bone pinning and putting wires on broken bones. And then she asked me, why are all the vets here always suggesting amputation?
Oh.
Because in the US, it's done. So I was challenged with that phrase. No, so I started asking colleagues overseas, how do I learn? How do I get the knowledge to fix bones properly? Yeah. So we managed to fix the broken bone of her cat. But it's not ideal because really by then I didn't know proper orthopedic management.
Okay.
So I happened to got hold of educators, colleagues they are Australian citizens,
Okay.
but we did our training in Thailand.
Oh.
Yeah, short course training.
Yeah. So has to be out of the country kasi wala naman dito.
Yeah.
Okay.
And then it basic, so it's just basic fracture repair, and I ended up studying more advanced procedures, like yung TPLO is when there's broken ligament,
Okay.
you put a special implant on the knee to make the dog walk again.
Oh.
And the most advanced, or yung ginawa natin kay Tofu.
Tofu, by the way, if you're
Total hip
watching on
replacement,
if you're watching on kick.com, he is showing off his cute butt right now. He's a bit shy.
That's what
now
they
he's-
do.
There you go. He's facing the camera, you guys.
Sorry about that, guys.
Okay, now he's facing the camera. Okay, so particularly Tofu's case again is what did you replace, Doc?
The hip joint.
Like it's
Joint.
replaced?
Yes.
Total hip replacement.
Oh my
Yeah.
gosh.
But they're long time client, and Tofu is a long time patient of ours. I don't know, how did you happen to know us? I don't remember. Sorry.
Oh nga, Hannah, how did you find Doc Aris?
So, I noticed that Tofu started limping. This was 4 years ago. He had a knee problem. And I asked around. So, we have a pet community in our neighborhood. And I asked around for recommendations on orthopedic surgeons that we could visit to have Tofu checked.
Yeah.
And Doc Aris came in highly recommended. So we decided to visit his clinic in Santa Ana. And when we saw Doc Aris, everything just clicked. So Doc Aris explained Tofu's situation very well. So at that time, he had knee issues. And the recommendation was for us to go through surgery. we just had a comfortable talk with Doc Aris, and I just felt that he's somebody we could really trust when it comes to tofu. So ever since then, Doc Aris has been Tofu.
And the rest is history.
The rest is history.
How many hips have you replaced? So how many surgeries like Tofu's case?
For Tofu, we did 4 procedures.
For tofu.
Yes. It was, as the joints are worsening, we address that. Yun naman yung sabi ko kay Hannah. No, we only address if you're seeing signs of limping.
Yeah.
So unang nagka-problem yung one of the knee.
Yeah.
So we had to reconstruct. Ang condition it's called medial patellar luxation.
Okay.
Basically, the kneecap is out of place because the bone, I think the development was not good. In a sense that it's not aligned.
Is it genetics kaya? Or may injury?
Sa mga journals, yes, merong genetic factor.
Okay.
But I believe meron ding effect yung pagiging hyperactive ng dog. When they're growing.
Tofu, I believe, loves to do zoomies.
Yes, he's a hyperactive dog. He was a hyperactive puppy.
So Hannah, when you saw him kind of limping, you knew something was wrong right away, no?
Yeah, because he was so he would limp on and off. He would lift his hind leg up, and then sometimes it would be down. Or I'd noticed that his stance isn't fully boxed. So normally, if a dog has a good stance when he stands on all fours, right, you could sort of almost like trace it, and it's a rectangle. For him, one of his legs would always be like out of place. So I kind of knew this looks
Something is
weird.
off.
Something is off, which is what led us to seek Doc Aris.
It is 3:35 on the show. That time check is brought to you by New Star Online. For a chance to enjoy exciting daily rewards and bonuses, experience New Star Online. Have fun, take it easy. Promo runs until December 31, 2026. EGLD reference number marketing 2026-0949. Gambling is for 21 years old and above only. Gambling can be addictive. Know when to stop. Email responsible gaming at pavcore.ph. Sabi ni designer that same as kids daw. If they want something, sumisigaw. From earlier. Designer that, you're so funny. And this is, I can't pronounce the name, but we have a new listener. Hi, Sundown as well. And
Hello.
Victor Torres. Okay, for those who just tuned in, we have Doc Aris. He is a board-certified vet orthopedic surgeon. And fur mom, Hannah, and our bionic dog guest, Tofu, here on Pets in the City. I got to get back to more of the music, more of our guests. After a few, here we go. Something from Maya and Robert called Romanticize. On today's best music, we are Magic 89.9.
Magic 89.9.
Beating on today's best music, we are Magic 89.9. 346 time check brought to you by McDonald's. Oh, I'm suddenly missing the fries.
Of McDonald's.
Of McDonald's, yeah. Okay.
What?
We don't get confused. There's, diba, may
Twist.
Never mind. Yeah, the Twister fries.
Twister.
I think they're back.
Is it?
I think so. Somebody tell us. Guys, on kick.com/magic899 TV. Okay. Hi, Boss Grandeur. Listening from
Di ko alam, laking
Gentry.
ano ako eh.
Back.
Laking bubuyog ako eh.
Oy. Okay. So
I gotta love the clown.
for those who just tuned in, we've got an orthopedic surgeon. Oh my gosh, so funny. Doc Aris, my co-host on Healthline, is an orthopedic surgeon too. Hi, Doc Ryan.
We're talking bones.
Diba?
Dogs and bones.
Okay, so you were talking about something off air that I said, save it for on air.
I was asking Doc Aris, how many surgeries have you done already? I mean, he is known to be, and sorry, I'm really a fan.
Is he the first? Doc, would you be able to say that you're the first ortho?
No.
Oh, okay. So
There were
marami na.
before me.
Okay, there were. Okay, so
Unique for his case and his clients.
okay.
And then the style. Is it like different styles ba?
No.
Diba? Or techniques?
There are textbook approaches. Kasi yun na yung proven eh.
Okay.
But, of course, it's subject to experimentation. If you find that the presentation of the fracture is unique. No, you have to adopt it.
Let's try to make it much more visual because most of our listeners probably are aware of orthopedic for
Humans.
people.
For just
for
yeah,
people.
right, like people.
Like I
humans.
have my own implant on my left leg.
Tumutunog ka ba sa x-ray?
There's a secret to that. That another friend told me. Should I say it on air? Baka pagalitan ako ng mga ibang ortho. Pero anyway, hindi ako tumutunog and I don't think anybody would tutunog pa. That was old technology.
Because of the materials now.
Yes,
that's being
because the
used.
technology now is mostly titanium, so hindi ka
Uy,
tutunog.
parang yung
So, si
kanta lang.
Tofu
Siya
hindi
titanium.
Yeah.
tutunog.
So, hindi siya tutunog.
So hindi
ko pa
tutunog
na-try.
yan. Okay, so it's been a standard. Okay.
Naka-titanium.
Pero yung nga,
Tofu.
Doc, describe us, okay, the best that you can. How does it work? What's the procedure? Kasi for humans, there were some procedures na awake ako. Like alam ko binabarena yung paa ko during the surgery. Diba? Alam ko may pinupukpok. Like my whole body was shaking pero I was numb. Pero for a dog, I'm guessing I can only imagine. Pero what's up? How do we do the procedure?
Okay.
Para ma-interest na kagad yung listeners.
I'll walk you step by step now. So,
Yun.
Tofu came in with a hip problem. So notice namin na yun yung cause ng pain, bone-to-bone contact sa hip joint. So what we did, we took an x-ray, digitized it, it's placed in a computer, tapos meron siyang scale. And then that x-ray that we took off, I put in a software. Tapos from there, we can measure yung implant size niya. And then yung measurement, we will send it to the manufacturer.
Okay.
No?
And then it's
will be-
custom made.
Yes, it will be produced tapos sent to us. Na yan, it's already ready to use. Sterilized na.
Oh, medical grade. Like
Yes, of course.
it's packed, right? You only open it during surgery.
So yung sa hip replacement niya, it has 4 components. So it's
Okay.
individually packed. So I called them, ready na for surgery. We prepped him for a day, fluid therapy, pre-medication, shaved the area, and then we did our thing. Ayun.
Nag-fasting din ba?
Meron din.
Oh,
Diba?
kailangan.
Are there screws? Kasi I have screws. Like I think I have 3 screws on
No,
my
I think
leg.
yours is different kasi fracture.
Yes.
Yung kay Tofu is more advanced. It's called impact and bio. I forgot the exact term, but basically the implant, the titanium implant, would eventually integrate into the bone.
Yeah.
Oh, so it's gonna grow into it.
Yes. So, siya,
Alright.
rough yung surface. We put it inside the bone, hammer it, no? And then we check on X-ray kung tama yung angulation. And then, limited the movement. Yun ang naging problem namin actually because for...
Yung post-surgery.
Yes,
kasi,
because for total hip replacement, hindi sila pwedeng tumakbo.
oh no. So,
Yeah.
what was it like, Hannah, having to take him home? Tapos
Yeah.
hindi mo naman
Pet mom.
masasabi.
diba?
How was it for you?
Hyperactive pa si Tofu, right?
So actually, so he had 2 hip replacement surgeries. Both hips were replaced. So the first one was the right hip. And actually, when he got home, he's already walking. I mean, of course, he would lift the operated leg up, but he was walking. So what we did was, we just restricted him to one part of the house. So for example, if we all decide we're gonna hang out in the bedroom, we all stay in the bedroom, close the door, and he can move around there very slowly, but we just keep him there. Thankfully, he wasn't makulit naman yet. No, first 3 months, hindi siya makulit. So we could, we didn't have to worry about him moving around too much. Thankfully also, so he has a brother who was also a Shiba Inu, si Soba. Thankfully, he also wasn't makulit
Soba.
naman, no?
Yeah.
So he wasn't trying to wrestle
To
with his
tease
brother.
him or,
Yeah. Maybe he knew what was up. I think he did.
I know. I think dogs can tell if the companion is kind of like in pain, or coach.
Yes. And then they would know because the dog in pain would probably snap back.
Yeah.
Right?
Yes,
Yes, he
that's right.
would. But the challenge came in. So what we did was we controlled his or restricted his movement for actually 6 months.
Oh, wow.
The first 3 months was pretty easy because he was just walking very slowly and all that, no issues. But from the 4th to the 6th month, he started feeling like he was Superman. He started doing zoomies, going up and down the
Again,
couch.
yeah.
All of those things
No
are
more
not
pain.
allowed yet. So it was really a concerted effort trying to stop him from making all those unnecessary movements, all the intense movements. But we also had to manage it such that he doesn't feel like all those things are bad things to do. Because eventually, he'll be able to do them, right?
Oo, tapos biglang
Oh, you don't want that negative association na being happy, running around is bad. Eventually, diba? Because he'll be allowed to do that. Now
Yeah.
he can do all of that.
Right, but
So
how
that-
did you feel? Sorry, how was the experience like seeing your dog out of the surgery and then caring and eventually seeing your dog like running again?
there's just so much relief for me because Tofu has been through a total of 4 surgeries,
Oh
2 on
my.
his knees,
Yeah.
2 to replace his hips, and now that so of course those were 4 difficult years for us because every year he would go through surgery, and it's such a emotionally draining time when your pet is going through something very difficult.
Girl, di ko nga
diba?
mapagupitan ng kuko to eh. Iyak ako, no?
So talagang it was very difficult for us, but now seeing him running around the house, now he can wrestle again with his brother.
Wrestle with
He can-
Soba.
Yeah, he can wrestle with Soba worry-free. It's really been life-changing for us.
Okay, let's just be honest, Doc, no? I mean, it sounds really expensive. If, like, say, a patient comes to you and they can't afford surgery, what, for the case of Tofu, are there,
Alternatives.
Yes, of
meron
course,
ba?
there are.
Okay.
Yung THR, total hip replacement, is the gold standard.
Yeah.
But there are other
Tayo sa
modalities.
silver tsaka sa bronze.
Yung
Budget
pinaka-common that we do is called FHO or FHNE, femoral head and neck excision. Basically, with hip dysplasia, what happens with the dog is nagkakaskasan or may
Ganun.
friction.
Yeah.
Right.
Bone to
with the
bone, yeah.
And it becomes painful eventually. First 8 months, the owner would not notice it. But after 8 months, when the growth spurt stops,
Yeah.
doon na nagiging evident limping, bunny
Right.
hopping. So, just we cut the bone, and then remove the friction.
Okay.
And then the dog can eventually walk and then run after therapy.
There you go. For those who just tuned in, this is Pets in the City, and we have a badass orthopedic surgeon in the vet world, Doc Aris, with us, and for Mom and Tofu on the show, Hannah and Tofu on the show. Let's get back to more of the music. This one's for Coach. No, it's Childish Gambino.
Magic 89.9.
Love me. Who got? It is 4:05. Time check brought to you by Rice Energy Pop Grape. Set up mag-rice. Rice Energy Pop Grape.
Sarap mag-rice.
May sound effect pa talaga.
Ganon. Attorney Aaron Pasado ba? He's tuned in. Also, our friends from Clean Fuel, Bonnie Corner, P. Cruz. Hi to Greg. Shout outs to you. Because they were
Hey.
listening to Sunday Slowdown. Like, Kuya, don't change station. Ganun eh. Batiin kita bukas. Okay. Hi, Kuya Greg. Okay. So, we have a listener question from Joey. Hang on.
And Joey says,
Doc, my dog has been limping for 2 days, but still wants to play. Should I wait it out or bring him to the vet immediately?
Okay, thank you for the question, Joey. Generally, we would recommend resting your dog for about 24 hours, and if it's still limping after that, seek veterinary care.
Panic. Just kidding.
I usually panic and then I go to dog.
Panic, then go to Doc Aris. Okay, for those who just tuned in, oh my gosh, we have a orthopedic surgeon. It's so funny, di ba? Dalawa silang orthopedic surgeon sa buhay ko.
Pang-tao at
Oo,
pang-hayop.
pang tao at pang hayop. Yan. So, and then also another listener question, what are the most common orthopedic surgeries daw that you perform and that you see in dogs pala, Doc?
Most common, depende sa breed, pero maraming fractures. Fracture repair.
Oh.
Yeah, especially Di ba sa atin, mostly toy breeds eh.
Right.
Toy poodle, shih tzu,
Yung mga
Greyfall.
minsan
Oh my
nahuhulog.
God, yung mga Yorkies. I have a
Yes,
Yorkie
even Yorkie.
student and I'm so scared for that Yorkie student.
Yeah.
Oh, yeah. I mean, chihuahuas as well. Di ba?
Saka
Kasi parang...
Yes.
we have a lot of HBCs.
What
Hit by cars.
HBC,
Oh, yes.
Hong Kong, parang bank yung naisip ko, di
It's
ba?
also called MVA, Motor Vehicle
Vehicle.
Accident.
Oh, no.
Oh my goodness. Yes.
Okay.
Kasi,
So just this morning, I repaired a fractured hip run over by a car, I think.
Oh, that's a lucky dog.
Yeah.
Okay.
Doc, are certain breeds now more prone to joint or bone problems?
Yes, there are predispositions. I'll give you an example. For medial patellar luxation or the problematic knee joint, it's common in toy poodles.
Oh.
Yeah.
And then, of course, I must say that Doc approved Covey's weight. Oh, di ba? Not
Yes.
bad. Because dachshunds are prone to...
Spinal injuries or
Oh.
IVDD.
Yeah.
Yes. And you can learn about that on my podcast, The Dog Behind the Human, wherein we discuss about dachshunds. Search for it on Spotify and on Apple Podcasts.
Doc, how advanced is vet orthopedic surgery now in the Philippines today?
I would say I tried gauging that based from what I learned from other colleagues in Europe. I think we are 5 years behind.
Sana ako din may colleague sa Europe.
No, because
for 5 years behind.
right now we are still on X-rays.
Oh.
Sila more on CT scans na.
CT scans
Yes.
for dogs.
Yes, for dogs.
Wow.
Yeah.
I can't even go for my own
But
CT.
bills are stacking up quickly.
There are already veterinary facilities here.
here, na
With
meron
that
naman,
offer
equipped.
CT
Yeah.
Look, Apple.
But I think our industry or the veterinaries are catching up.
Yeah.
That's good to know.
We are a lot of friends are going overseas to study, to advance their knowledge. Tapos, well, I'm comparing naman yung sa imaging kasi ang
Because it starts with that.
yes, ang orthopedics heavy on imaging.
Right, right.
So-
but no MRIs.
No,
Do we have
Meron na,
that?
yeah.
Wow, that's-
Meron may MRI dito.
Wow. All right. So going back, Doc, kasi I have this hanging question on my head. All right, let's say we do hip replacement, right? So the way I understand it, you have the cartilage, right? That's one
Yes.
of the major issues why you have those friction
Yes.
because it depletes depending on the breed or how the dog was bred along the line. Okay. My question is, does that get replaced as well?
yes. So imagine, you have a cup,
Yeah.
the cartilage, yung acetabulum, it gets grinded down
Right.
until we get to the bone bed.
Mm-hmm.
No, tapos yung natanggal, so it's pre-measured, we will replace it with an artificial cup. That's titanium,
Okay.
and it will integrate into the bone. But the other side is smooth. I forgot the composite, but it's also a they sort of put some chemical on it
Okay.
to make that area smoother than or
Is it smoother than the
close to the
organic?
original. Close to the original.
Oh, so no silicone implants, anything that would mimic.
Merong component na hard plastic, surgical
Oh.
grade plastic, para kung tatalon sila.
So there's still cushion.
Meron yes, may cushioning.
Oh, so it's almost close to
Yes.
the organic, natural thing,
Yes.
right? Okay.
Hannah, I have a hanging question for you. You will answer it. You will answer it after the break. No, did you ever find yourself weighing the emotional decision against, financial reality? Because 4 surgeries, and we know that it ain't cheap. Okay, so for those of you just tuned in, Hannah is the fur mom of Tofu, who has titanium plates lang naman, guys.
Yes.
So we will have her answer after a song, and let's hear the breaker first, because Doc Apple is finally in.
Tino Ryan, Dog Coach Francis, and Doc Apple on Pets in the City.
Magic 89.9.
Today's best music, Match 89.9. Choom, Baby Monster. What do you think Choom
Baby
means?
Monster.
Choom, ano Choom?
Aywan ko.
Let's find out. I'm gonna
Mga
Google it in a bit.
Millennial terms.
And before that was
sorry, I'm a time traveler. I was from the year 2000.
Sure, okay.
I don't know any of that.
Before that was Post Malone with Doja Cat and I Like You, a happier song. There you go. It is 4:24 on Pets in the City, and we have a hanging question for Fur Mom Hannah.
And the hanging question is?
What did you ever find yourself weighing the emotional decision against the financial reality?
I have to say, my husband and I are very lucky that we were able to put ourselves in a position wherein we are able to always just simply choose what's best for our pets. So the decision-making process when it comes to all 4 surgeries of Tofu was really, I guess, more of a logical and emotional decision for us. So it was really that. The frame of thought was always just about what is the best choice for our pets. So I guess we're very fortunate in that way.
Yeah. And always, kikitain din yan. Parang ganon, di ba?
We can make the money.
Yes, we
Right,
can
we
work
can make
hard.
the-
Yeah.
And I
I
think
will sell
for-
my other kidney for COVID. Tanong ko may value pa doon.
May bibili pa ba?
Yun ang tanong kung may buyer.
May I just comment. Kasi baka may perception
Uh-huh.
na vets are always in for the money.
Oh, yeah. Okay.
Maraming ganyan.
Hindi ba
That's why I didn't-
there's actually...
I love how you said that because yes, Doc.
Yes.
Oo. Parang some vets kind of left a bad taste on patients
Right.
mouth. So I love that you said that.
Well, I'm speaking for myself. No, but I know a lot. No, it's all about passion.
Right.
If the client cannot afford, they tell us directly. We'll find a way.
Okay.
Right.
No, we will do with what we have, or kung ano lang capability ng client.
Yeah.
I know someone, a personal friend of mine, na who works on rescues din. Na kung talagang if you can do it, you have the means, you have the skills.
Yeah, go for it.
But the owner doesn't have the capability to pay. You extend your services. Kung pwede for free, di ba?
Doc Aris is my new hero.
Ganon din yun. Kikitain ko naman yun sa
Yeah.
iba.
Yeah.
Or that client who I did something good to may promote or endorse my clinic. I get
Getting
your
emotional.
vet are humans too.
Yeah. Oo. And I was actually about to say earlier, fortunate sila, Miss Hannah, that, the financial aspect, they really didn't have to worry about that too much. But we would like to encourage the pet owners out there, talk to your vets. Nabanggit naman ni Doc Aris, there are other options but your vet needs to know. Be honest, be straightforward, so that your vet can find the best way na kakayanin din. And yun na nga, if such is not the case, kunwari yung current na vet ninyo, what I like about the veterinary community, at least a good majority of us, gone are the days na parang takot ka mag-refer or ano. Ngayon, referrals are actually being embraced.
Of course.
So,
yeah.
meron ka talagang mga vets na ma-encounter na I can't do this for certain reasons, but let me refer you to this one.
Oh, I love
So
that.
kaya, pet owners, please do not be afraid to talk to your vet. That's the best thing you could do. May help your vet, or let your vet help you make that decision on how you will take care of the situation of your pet.
I think I feel like we need a group hug right now.
And then also, DJ, there are groups in the veterinary industry that are advocating continuing education
Yes.
for vets. No, that's one of our advocacy. We train other vets, younger vets, to
Even older
the
vets.
skills. Yes, of course. As long as you are trainable and willing to do the hours, pwede natin ituro yung mga skills that we learned overseas. No, kasi we are all for advancement of the local veterinary practice. No, not just
For the
ourselves.
country.
Yes, of course.
Oo, diba?
For
Para
the
sa pamilya.
dogs.
Yes.
For the pets.
It is 4:28. Time check brought to you by EO Executive Optical. For expert eye care, come to EO Executive Optical. EO Executive Optical. Love your eyes. Okay, so any more questions for Doc? Because I wanted to share something, but I might cry, so never mind. I'll take a break. But I could play one more song. Yok na yun. Just kidding. Any...
No, I would just like to ask Doc Aris if there's any upcoming master classes being organized that other vets, young and old like me, can
we
attend.
used to hold orthopedic master class, but right now, medyo sa sideline muna kami kasi marami naman available
ngayon. Okay.
Yung mga organizations ng mga
The professional organizations are
if they're vet related are conducting courses. Maraming naka-line up for the year.
Okay.
Yeah. And ako nga attendee ako this coming August. Sa Pahaw, we invited a renowned Italian orthopedic surgeon. Yun, idol ko yun, no? Si Dr. Petazzoni.
He's coming here,
Yes,
Doc? O, dali mo
yes.
dito sa show, Doc.
Bisita kayo dito.
I don't know if I can, pero yeah.
Pet Mom Hannah, ako meron akong tanong sa'yo. I'm not sure kung natanong namin kanina, right? So, why a Shiba?
Why a Shiba? Well, they're quite the character. If you guys have seen all these memes and posts about them
The
online.
Shiba coin, I know that.
So they have such a unique and interesting personality that makes every day at home funnier and more exciting and well, sometimes a challenge because you know
You wanted excitement. I think
wanted
he has
excitement.
given you so much excitement, including the hip replacement.
Like he gave us a lot. He gives us excitement every year.
Yearly
Wish
excitement.
granted.
Aside from the hip, she was like,
Financial excitement yearly.
aside from that, parang there's so many dogs out there. What's that so unique about a Shiba?
The scream.
They know what they want and they will try to get it. And I find that so amusing about him. It's like, okay, I respect that. Going for whatever it is you want, I respect that. So I like that about my dog. It's a nice way of saying they're stubborn.
It's
Stubborn is a nice way.
I was telling Sana earlier, so they're pretty much like cats.
Yes, in a way they are. In fact,
And I
they
love
groom
cats.
themselves talaga ha. As in they would lick their entire body clean like cats.
And snobbish din sila.
Yes, they are.
Yeah.
They are.
A bit shy at first. Takes them a while
if
to
you want
open
that
up.
kind of dog, go get a Shiba.
I wanted nga pala to ask yung kanina we were...
Wait, hold that thought.
Later.
We gotta
Sige.
take a break.
All right.
Quick break, one song, and then more questions for our guests.
Magic 89.9. Magic 89.9.
Okay, so we are wrapping up. Oh my gosh, so many good things that we were talking about off air. Again, we want to thank Doc Aris.
Yeah,
he is
welcome.
a
It's my pleasure.
orthopedic surgeon for our furry friends, and for Mom Hannah. And thank you so much for bringing
Thank you so
Tofu
much for
over.
having us.
So behaved.
Yeah.
Oo. Pwede tayo magpalit. Ganun.
Okay.
Swap dogs, diba?
but before we go, we
yeah.
are going to have a quick rundown.
Let's have a flash round.
Para tong ano
Yeah, Doc Aris. So I'm going to name 10 dogs.
Okay.
And then based on the 10 dog breeds that I'm going to be asking, tell us the common issues for these dogs orthopedic wise. Okay?
I'll do my best.
All right. So first is Poodle,
Patellar luxation.
which is
Knee
Sorry.
problem or hip,
okay.
hip problem.
All right, Beagle.
Generally okay, wala silang
Wala masyado.
Oh,
So,
Chihuahua.
Chihuahua, broken forelimb,
Oh.
sustained from fall.
Okay, it's not from shaking. Okay.
No, also they get bitten by bigger dogs, so nagkakaroon ng
yeah.
mandibular fracture.
Kasi maliit
Kasi-
na pero ang tapang nila.
Dog,
Yeah.
diba? Medyo a-holes
They were
yung mga
calling for
Chihuahua
it.
eh.
No, for dogs,
Their attitude,
when
man.
they get into fight, wala yung size eh.
Yeah.
Oh my gosh, I had a Chihuahua. Peanut thinks he's like a Doberman. Man.
Next, Pomeranian.
Pomeranian also
Same as the
Patella.
Chihuahuas na
Okay.
ganun.
Golden Retriever.
hip dysplasia.
Okay. German Shepherd.
Yes, also hip problem, knee problem.
Siberian Husky.
Hip problem. Because medyo diluted yung genes dito, nagkakaroon na inbreeding.
Oh, that's why.
Wait, what? Diluted? Okay.
Diluted.
We'll talk about that. Yeah.
There are, some of the parent stock
Yeah.
are related.
Oh.
Yeah,
So,
okay.
they sort of inbreeding.
Oh.
So, nagkakaroon siya ng
Okay.
hip dysplasia. Yeah.
So let's
that's
not
a
do
factor
that.
also.
Labrador Retriever.
Hip dysplasia also. Knee,
Okay.
hip problem.
How about a Shih Tzu?
Shih Tzu, generally, wala. But if they get into a fight, also mandibular fracture.
Okay. And the most famous dog in the Philippines, the Aspen.
Aspen.
Yan, very, very common, hit by car.
Oh,
Unfortunately, they're the number one candidate. Oh my goodness. Thank you so much,
Thank
dog.
you,
that
dog.
was fun.
Thank you, Miss Hannah.
Thank you.
Shout outs to Wowie and the Beagle community. Okay, so we do hope to have you back, Doc.
Yeah. Sure.
Doc Harrison. Hannah, feel free to stop by whenever you get bored. We're
Bring
here.
soba.
I'll bring tofu and soba.
Right?
Yeah.
We're here
I love
Mondays.
tofu and soba.
And so together.
Mondays, girl, 3 to 5. We're here if you get bored. Okay. So, anything else you want to add before we say bye?
Again, please listen to The Dog Behind the Human on Spotify and Apple Podcasts. We have new episodes coming up. I finished writing them, and we tried to make it much more animated and easily consumable. Again, that's on The Dog Behind the Human on Spotify. So
Doc
listen to
Apple. Thank you for inviting Doc Aris.
Yeah, I'm really happy that we had Doc Aris and Hannah here.
Yeah.
Very proud actually. Ay, parang proud mama.
Diba?
Batchmate, Brad, lahat na.
Oh my.
Very inspiring actually.
4:44 on the show. That time check's brought to you by Playtime Entertainment. Born for happiness. We are going to leave you all with something from... but before that, tomorrow, we will talk about hair and teeth. For Healthline. So catch me back with Doc Ryland, my orthopedic surgeon partner. Here we go. Leve with Mad Woman on today's Best Music.
Magic,
Magic
89.9.
Magic 89.9.